And welcome in, folks, to Medicare Made ABCDEasy here on WRMN on the first Tuesday of every month, right here on WRMN AM 1410. We've got Danny Gilly here on the phone lines taking over.
Yes, good morning, and welcome to our Medicare Made ABCDEasy workshop online. We have a call-in number that you can use. Yeah, so if you have any questions during our hour presentation this morning, it's 847-931-1410. Again, that's 847-931-1410. And, of course, you can always call us on our reservation line, which is 630-320-6906. Again, that's 630-320-6906. Just leave a message, and we will get right back to you within the day. Also, you can go on our website. It's D as in dog, G as in George, insurance.com. And on that site, you can actually leave a message for me, Eric, or Julianne. We'll have upcoming workshops, and our workshops will actually start next month. And you can actually enroll into a workshop and look at all the different locations. And that's a good website that you can get information in with us. And with that, I'm going to go ahead and get started this morning. The biggest questions that you're going to ask is, what is Medicare? Well, believe it or not, Medicare is very similar to your group insurance that you have now. So if you're working for a large corporation and they have an insurance policy for you, and you're going to also notice that in that insurance policy, there's some holes or areas that you have deductibles or co-pays. Medicare is kind of the same way, only Medicare is a little more broken down into a couple different programs that is available to you. Okay, let's get started. All right. Okay, basically, Medicare is broken down into Medicare and Medicaid. Okay, so in the federal government, Medicare is a health insurance program for people 65 years of age or older, people under 65 with certain disabilities, people of all ages with end-stage renal disease, which is kidney failure. Now, Medicaid, that's a joint federal and state program that pays medical costs for those who with limited income and resources. It is means tested. And a person that qualifies for both Medicare and Medicaid, we call that dual eligible. Now, what we're going to talk about is what is Medicare. You apply for Medicare, and there's two different segments on that Medicare card. So if you look at your red, white, and blue card that says Medicare health insurance, you're going to have your name is going to be on that. Then you're going to have your Medicare number, which is a number that's given to you when you enroll into Medicare. Then it's going to have hospital Part A. Then there's going to be a date of your coverage start. And then you're going to have Part B, which is the date of your start for Part B. Now, if you're going to get any type of additional coverage for Medicare, and I'm talking about Medicare supplements or Medicare Advantage plans, you do have to have both Part A and Part B in order to enroll into those plans. Now, today, what we're going to talk about, we're going to separate between a Medicare supplement and an Advantage plan. And because you're going to choose one of those two plans if you go into Medicare. One of the reasons being is because there's a lot of holes in Medicare, and I'm going to go through some of the holes in Medicare. And you want to have an ability to kind of cover some of that things that Medicare does not cover. And I'm going to go through there and show you what the costs are. So let's get started. Now, first, let's find out what Part A is, because you have to have Part A, right? So Part A is your hospital insurance. Okay, there's no premium due for most people if you have a minimum of 40 quarters of Medicare taxes paid for premiums. So that Part A cost is already covered for you during that 40 quarters. Eligible prior to age 65 for some people, example, diabetes and end-stage renal disease. You can get coverage under 65 under certain circumstances. Who will pay a premium? People with less than 10 years of Medicare-covered employment can still get Part A, but then you'd have to pay for it. But no, there are citizen requirements to qualify for Part A, even with a premium. Now, Part A, remember I told you there's some charges. Now, Part A has some deductible. So it's broken down into like a 60-day window. So if you go into the hospital and all you have is your red, white, and blue card, okay, and you have your Part A coverage and your Part B coverage, well, in your Part A coverage, there's a 60-day window. So day 1 through day 60, there's a $1,736 deductible. Now, that's not an annual deductible. That's just for a 60-day window. So let's say you go into the hospital in January, and then you go again in April. Well, then you would be outside of that 60-day window, and you would have to pay that $1,736 deductible all over again. Or let's say you were in the hospital, and from day 1 to day 60 is that deductible. But say you stayed in the hospital 61 days through 90, that would be $434 per day, and 91 through 150, it would be $868 per day. But let me explain. We very seldom see anybody because in going into the hospital, they get you in and out as soon as possible. So we don't see that too much in today's world, but there are some deductibles there and some co-pays. Now let's go into skilled nursing coverage. Now, keep in mind, in Medicare world, okay, there is not any long-term coverage for Medicare. The Medicare nursing facility is only for rehabilitation. So if you go into the hospital and you're in the hospital 3 days, and then they move you to a skilled nursing facility, day 0 through day 20 is picked up by Medicare. So there are no additional charges for you. But if you do have to stay any beyond that, so day 21 through 100, the cost would be $217 per day that you would have to pay. If you stayed above 101 days and beyond, you are responsible for all costs, because keep in mind, this is not long-term care. This is physically get you back up on your feet, get you some rehab. Usually we'll see this when clients have a knee replacement, or they have a hip replacement, or say they had a surgery of some type and there's some rehab that they have to do that they would do in a nursing home, because it's cheaper for Medicare to move you to a nursing home for care than leave you in the hospital. So basically, that's what the costs are. Now, there's also Part B. Now, Part B is the medical insurance. And now, when I talk about medical insurance, it has anything to do with the doctor. It can be a nurse practitioner. It can be running diagnostic testing, MRIs, anything. Say you had to go to an emergency room or a walk-in clinic or to see your doctor. That's all part of Part B. Okay. Now, enrollment into Part B is optional. So it basically means, well, you don't have to take it if you don't want it, but there is a penalty if you don't take Medicare Part B, enroll into it when you are in your what we call initial enrollment into Medicare. That's a 7-month window, 3 months prior to the month of your eligibility. So let's say you're turning 65, and you're turning 65 in April. Well, you got 3 months prior, the month of, and 3 months afterwards to actually enroll into your IEP or initial enrollment period. Okay? So regardless whether, let's just assume everybody has an April birthday, or you're 80 years old and you're just now turning on your Medicare for the first time because you've had group coverage all this time. Well, again, you have 3 months prior, the month of, and 3 months after, at the end of July, and you still have not enrolled into your Part B. Then what happens is we have initial enrollment, general enrollment period. And so if you miss your initial enrollment period, then there is what we call a general enrollment period. And that's January 1 through March 31st, and coverage will be effective the month right after you sign up. Annual deductible, this is not a typo. Part B deductible is $283 per year. Starts in January and goes through December and restarts again in January. Medicare pays 80%, and you pay 20% of any medically approved expenses. So that's some of the holes in Medicare. So that's, I'm also going to show you the next part of Medicare is your prescription drug plan. So your prescription drug plan, you have two options. It's either going to be a standalone drug plan through one of the private companies out there, or it's going to be a prescription drug plan integrated inside your Medicare Advantage plan. Okay, Part D drug plan, who's eligible? Well, anybody who is enrolled into Medicare Part A and or Part B and permanently reside in a service area. That just basically means if you reside in Elgin, well, during the zip code for Elgin, you can enroll into a drug plan. You can't enroll into a drug plan in Florida that's offered because it has to pertain to your service area, okay? And then also there's people who qualify for both Medicare and Medicaid. That's dual eligible. People can choose to enroll into Part D. They don't have to, but again, higher premiums for those who wait, except there's an exception. And this also pertains in Part D to Part B. Exception is with those the coverage is at least as good as Medicare prescription drug coverage. For example, if you have a VA drug benefits, or you're an employer, you have an employer group plan. Well, that's as good as Medicare. So basically, there are no penalties. So if you have group coverage and you decide that you're going to retire and go on to Medicare, then there is no penalty for as long as you've had your group coverage and it was credible prior to you enrolling into Medicare. Now, the Inflation Reduction Act, I'm going to go over that just for a little bit because some people will find themselves in this area. Signed into law in August 16, 2022, and it caps out-of-pocket Medicare Part D costs at in 2026 is $2,100. So what does that mean? It means if you have a drug plan and you have over $2,100 in out-of-pocket, so it's the medications that you have that's covered under your group plan or under your drug plan, and you exceed $2,100 in costs, anything above that is at no charge. So this is was put into effect to kind of help some of the clients out there that was having $3,000 and $4,000 a year drug costs. So they've kind of made it a little more appetizing for you, so the cost is kind of controlled. Okay, so what I want to talk about next, we're just going to separate it between the Medicare supplement and the Advantage plan. Because remember, I just went over all of the co-pays that you would have in your Part A and your Part B co-pays. And so what I want to talk about is once your co-pays are taken care of, or you want to figure out a way that you can handle some of those co-pays, your Part A deductible, your deductible for your skilled nursing care. Okay, so there's some areas that you can use. One of them is going to be a Medicare supplement insurance program. Now, in the Medicare insurance coverage, there's over 50 carriers let's just give you in the Illinois area, they have different carriers. Now, you're going to find that the carriers are going to be within a few dollars of each one, and you're going to have the option to select what plan you want. Now, let's just give you an example of Plan G, because in all Medicare supplements, or we call them Medigap plans, are offered by insurance companies under the strict guidelines of Medicare. All Medicare supplement plans with the same letter category have the identical standardized benefits. So let me give you an example. Plan G, let's just use that for an example. And just assume it's a can of Coke, okay? Now, you can pick up a can of Coke at Walmart, Mariano's, Osco Drugs. Now, none of those companies are actually bottling that can of Coke in the back room. What happens is the Coca-Cola company is delivering that can of Coke to those different drugstores, and you purchase it from them. So Medicare supplements work the same way. Medicare makes that plan. So I'm just giving an example for Plan G. So Medicare makes that Plan G and delivers it to all the different insurance companies that sell Medicare, Medigap, or Medicare supplements. So a Plan G for one supplement company is identical to the next company that you see out there. The only difference is going to be the price, just like the Coca-Cola can of Coke that you buy at Walmart, Mariano's, Osco. There could be a different price. So what we want to do is we look at the price that they charge in the area, and that kind of determines, which company you're going to choose. So because we know now that all the coverage is identical. So if you have an insurance agent talk to you and say, oh, you got to buy my Plan G, it's the best one out there. Our plan is better than anybody else's. Well, you know that they're kind of filling you a lie, because as you know now that the Plan G is identical. It doesn't make any difference what company you buy it from. And then the same thing happens when I have a client that is on a Medicare supplement, and let's say they have some rate increases, that company has some rate increases, and I suggest that we go to a different company and enroll them into a different company if their health requirements are there. And they go, well, what's the difference? Well, and I just say to them, well, it's the color of the card. Plan G is the same regardless where we buy it. So your coverage is identical. It's just you're selecting a different company. That's like you're buying that can of Coke from a different grocery store. So that's the difference between the two. So what we have in the Medicare supplement, right now, the plans that you're going to see is Plan G or Plan N. If you had Plan F prior to 2020, you could have Plan F, because after 2020, Plan F was no longer sold. You can still get it if you enrolled into Medicare before 2020, but I can tell you now, if you have a Plan F, you want to get off of that plan as soon as possible because the costs of those Plan Fs have really shot up there in price. Number one being there's no young people going into those plans. So consequently, the only ones that are going into those are the older people, and the elderly people that are older are using those plans more often. And just like any insurance program, the cost of each one of those is spread out with the people that are in that plan. So you want to make sure that if you're in a Plan F, we would want to try to move you out of there and put you into a Plan G or a Plan N. The only difference between the Plan G and the Plan F is the annual deductible. And we know what that one is $283. So even if you paid the $283 annual deductible, you're still going to save on your monthly premium about $50 to $60 a month. So it is really important that if you are on a Plan F out there, make sure you give me a call and let's set something else up for you or see what's available for you. The other one is Plan N. A lot of clients have elected to move to Plan N because it has a little bit of difference. It has some co-pays that apply. And in the co-pays that are applied is basically, well, I'll tell you what, we're getting ready for a break, and I'm going to follow up on this as soon as we get through with our break.
With your news flash, I'm Ryan Gatenby. Brought to you by Chick-fil-A. A new proposal would create a commission to investigate potential ties between Jeffrey Epstein's trafficking network and Illinois institutions. The bipartisan panel would have subpoena power and could refer evidence to prosecutors. The measure is now pending in the General Assembly. Illinois Comptroller Susana Mendoza has endorsed Lake County Treasurer Holly Kim to succeed her in office. The endorsement sets up a political split with Governor J.B. Pritzker, who is backing State Representative Margaret Croak for the position. Illinois Governor J.B. Pritzker says President Trump is sidestepping the Constitution after ordering military operations in Iran. In social media posts, Pritzker said the president acted without congressional authorization and failed to clearly explain the objective of the strikes. I'm Ryan Gatenby with your news flash.
Straight Talk Wireless presents Pickup Truck Wisdom.
Trust is earned. That's why I've stuck with Straight Talk. Same price as 2009 on Verizon's 5G network. Because shoot, anyone can make a promise. Keeping it for years, that means something.
Now plans starting at $25 a month with 4 lines. Find us at straighttalk.com and Walmart. Straight Talk Wireless. Straightforward. Always. Same price claim applies only to the base monthly price of our $45 plan from October 2009 to present.
Wesley Financial Group is not a law firm, and Chuck McDowell definitely not an attorney. This is Chuck. If someone talked you into buying something really silly and you want to get out of that silly little thing, my advice, get the facts. Call me and I'll send you our timeshare exit kit absolutely free. Inside, you'll learn how timeshare works and all your options for cancellation.
Call Wesley now for your free exit information kit. 800-909-9696. 800-909-9696.
Welcome to downtown Elgin, where businesses, community, and creativity come together. The Downtown Neighborhood Association provides valuable, complimentary services to all downtown businesses, organizations, property owners, and residents, helping you gain exposure and thrive. Whether you're already part of the district or exploring a new downtown location, DNA is here to help your vision grow. Join us in creating a vibrant, connected, and successful downtown Elgin. Call now 847-488-1456, or you can email info@downtownelgin.com. As for Jennifer Facala, Downtown Neighborhood Association, where the heart of business beats strong.
This is Sarah Silver with your Fox Valley forecast, brought to you by Chick-fil-A. Today, mostly cloudy with a high near 42. This afternoon, temperatures around 40. Tonight, mostly cloudy with a low of 32. Looking ahead to Wednesday, a slight chance of rain showers with a high near 44. Rain showers likely Wednesday night with a low around 40. Currently, it's 35 and overcast. I'm Sarah Silver on the Talk of the Town, WRMN.
The second I see that Chick-fil-A text in the group chat, I'm throwing my shoes on and running out the door. Hey, I'm Layla.
And I'm Kaylin.
And a little thing we love about the Chick-fil-A chicken biscuit is
how it feels like an easygoing morning.
The chicken adds the most flavor. It's juicy and seasoned.
The biscuit is just very light and airy and fluffy, just like a cloud.
I also love to put jelly on mine so it's sweet and savory.
It's a good start to the day.
Mornings are a little bit brighter with the Chick-fil-A chicken biscuit and Simply Orange Juice. Available on the Chick-fil-A app. Real guests paid for their testimonials.
And welcome back, folks, to Medicare Made ABCDEasy with your host, Danny Gilly.
Okay, so I'm going to follow up where I left off at. And we're talking about Plan N. Okay, Plan N came out back in 2010. And it is kind of on a copay situation. So give you an example. If you go to a doctor, any doctor, specialist, your PCP doctor, doesn't matter. It's a $20 copay. A nurse practitioner, it's a $20 copay. So the reason why I bring this up is because if you go, also there's a copay if you go to the emergency room, it's $50. But by selecting Plan N over Plan G, you can save considerable amounts of money on a monthly basis. So a lot of people that are on a Plan G and you just got that notification from your insurance company that your Plan G cost has gone up by $50, $60 a month, and you go, that's really kind of costly, and I got to do something to reduce that cost. Well, we're looking at a couple different things. One of them would be looking at the Plan N. So to give you an example, if you only go to the doctor a couple times a year and you may have no more than a $20 copay to see a doctor, and so maybe a couple trips to the doctor, you might have $20, $40, $60, but you may save $25, $30 per month. So it is feasible, and it is something that you want to look at. There is something else in there, and it's called the excess charge. There's a 15% excess charge. Now, excess charge is, let's give you an example. Say you have a surgeon that you want to go to, and that surgeon is not a part of the Medicare program, but accepts Medicare payment. But they're allowed to add a 15% surcharge. Okay. Now, on Plan N, you pay that difference in surcharge. Plan G, it's covered for you. Do we see that a lot? No, we don't. But there is an option that you can go to that Plan N and save considerable amounts of monthly premium. So we found that since this last few months, we've seen a lot of rate increases for Medicare supplements. And part of the reason is because this is the explanation that I get from the insurance companies, that because more and more people are, let's say they were needing a knee replacement, and they decided to put that off until they got into Medicare. Because remember, initial enrollment into Medicare, there's no health questions asked. So they would wait and say, I'm going to have that knee replacement, or I'm going to have the hip replacement, or, I have a shoulder that we've been talking about having that shoulder repaired, surgery that's done on that. And so what's happened over the years is there's been more and more people that are choosing to wait until they get onto Medicare and get some of these surgery, special elective surgeries done. And they said because of that, it's added up. And, of course, because of the years past when we had COVID, that there's been a lot of changes. And, of course, Medicare has some different costs that have gone up. And so they're passing those costs on to the clients. So those are ways that you can alleviate that. There's also some companies out there that offer a select plan. Select plan basically means that if it depends on your area, service area, that if I choose that hospital for my elective surgeries in that area that you live in, and if you select that select plan, so let's say you could go with the Plan G Select, you could save a good $30, $40 a month by choosing that particular program. So there are a couple things out there that we can do that if you find that you're getting higher rates into Medicare supplement coverage. And I know because I'm on Medicare supplement too. And so I've gotten hit with some of the rate increases. But my first option, if I have anybody that has some rate increase, is to look out there to see if there's another company out there that can give you that same coverage or close to it for a reduced premium. And keep in mind, on Medicare supplements, you can change that supplement every month of the year if you want. You don't have to wait for the annual enrollment in October 15th through December 7th. That is only for Advantage plans and prescription drug plans. On Medicare supplements, you can change those plans every month. So if you do get a letter and you've got a rate increase out there and you want to know what some of the options are available to you, just make sure you give me a call on our reservation line. It's 630-320-6906. And the reason why I'm bringing this up and really talking about that is because there has been a number of rate increases, and every one of the companies and the Medicare supplement areas have done it. Now, that doesn't mean that the company that you have is going to be the best price. Could be another company out there that has a lesser premium for the same product. So, we just have to look and see. And now, that there are health questions asked. So if you're outside of initial enrollment into Medicare and you decide that you want to look at different coverage companies through supplements, there's health questions that they ask. Now, they can decline your coverage. That doesn't mean that you can't if you do get a decline, you can still stay where you are, or we can look at different companies because different companies have different guidelines as far as their coverage. Give you an example. Let's say you were diagnosed with cancer and you went through all the cancer treatments. Some companies are a 2-year wait period, and the other companies are a 3-year wait period. So it really depends on just because you got a decline from one company, it doesn't mean that we can't look at a different company and try to get a company to write and underwrite your Medicare supplement for you. So just so that you know that there are some options out there. I know that I have one client that called me and she goes, Danny, I've been on this same company for a number of years, and she was a new client, and she says, my premiums have gone up so high. And I says, well, let me see, what type of coverage do you have? Well, I have Plan F. And I said, well, that's the biggest problem right there is you have a Plan F. And I said, a lot of those companies that have Plan F, the premiums have quadrupled in those. She says, yes, but I know there's nothing out there because, I had a heart attack a few years back, and I'm on a lot of medications. So the chances of me getting somebody to accept me is next to none. And I explained it to her, well, there is one company that's available in Illinois that in your particular case, they do not ask any health questions. They take everybody. But the difference is sometimes the premiums are higher. But something I have found out, though, and over the years of me being in the insurance business, sometimes if you're in a company and you've been in it a good many years, and they've taken huge rate increases over the years, especially if you were in a Plan F, that one company that doesn't ask any health questions that I can get you in can actually save you money. So always remember, you want to look and you want to check to see what's available out there for you and then make a decision as to whether or not you make that changeover. And like I said before, there's been a situation where the company that we applied for that didn't accept, and we had to go to another company, and they were accepted. So, again, it's just some extra paperwork that we can go through. But remember, once you have a coverage in a Medicare supplement, the only way that company can cancel you is from the lack of payment. So they can't deny your coverage because you've been utilizing the services. No, the only way that they can cancel your service is from the lack of payment, non-payment. So those are some of the things that you really want to look at. And the reason why I'm covering this kind of in depth this month, is because we've had a lot of questions about some of the price increases in the Medicare supplement area. Now I'm going to touch a little bit on Medicare Advantage plans, because I have a couple of my clients that says, well, Danny, this Medicare supplement is getting so expensive for me. Is there any alternatives out there for me? And I go, yeah, there is. and we can look at what a Medicare Advantage has to offer. But again, it's not available right now. So open enrollment for a Medicare Advantage is October 15th through December 7th with a January start date. So I basically say, we have to get you something. Maybe we go to the Plan In or go to a select plan, something like that, if you want to. And then in October, I would go through to see what a Medicare Advantage has to offer. Now, keep in mind, Medicare Advantage plans are totally different than what Medicare supplements are. And a lot of people that's been on Medicare supplements for a number of years, it's a rude awakening for them when they get into the Advantage side. So to give you an example, I'm going to put a Medicare supplement on one side and an Advantage plan on the other side. So on a Medicare supplement, you can go to any doctor or any hospital in the United States that takes Medicare. So that's pretty much everybody. And Medicare has as far as their coverages, anything that's medically necessary. Okay? Now, in the other side, is you go to the Advantage side, you go away from your original Medicare, and you go to private carrier in what a Medicare Advantage is. Private carrier, Humana, Aetna, all of those different companies out there that are what you consider private carrier now. And on the Advantage side, you have HMOs and PPOs, and so those are different types of plans inside the Advantage plan. So I'll give you an example. An HMO, you are limited to the networks. They're a much smaller network. You have to stay inside that network. And if you go outside that network, you don't have any coverage. On a PPO, it's a much larger network. You have more selections. You don't have to select your PCP doctor because you can go to any doctor in that PPO. And you can go outside of network. So let's say the doctor that you want is outside of that network. You can go outside of that network, and then, of course, the copays are higher. And the maximum out of coverage is higher. So I'll give you an example. On each and every one of these HMOs or PPOs has a maximum out-of-pocket coverage. It is not a deductible because there is no deductibles. What it says basically, if you look at your copays, and because there's copays for everything, to see the PCP doctor, usually in those there is no charge for that. If you go outside of network in a PPO, then there can be a charge for the PCP doctor. All the specialists, there's going to be additional charges. The charges are higher if you go outside of network. If you go to a hospital, any hospital that you go to that's in the network in the HMO or in the PPO, you have a much larger networks, and some of the coverages that we have in the Elgin, DuPage area, there's like 5 or 6 hospitals that you can choose. So your options are a little bit different, but everything that you have done in an Advantage plan, unlike the supplement, you pay that one annual deductible and your premium, and that's all you pay. On the Advantage plan, let's say you have an MRI, that there could be a $200 charge there. You go into the hospital, and the first 7 days, there can be a $300 a day per charge. Any diagnostic testing, there's certain charges for each test that you would take. If you got diagnosed with cancer, give you an example, there can be a copay for, let's say you had to have radiation, and you had to have an MRI and a PET scan. So all of these would be added up because on the Advantage side, that's pay as you go. In other words, every time you have, there's a copay for each thing that you have done. There is no charge for the monthly premium on an Advantage plan in most cases. It's a zero premium, but you do have the copays. Now, each plan has a maximum of copays per year. So, to give you an example, if you reach that maximum copay on that Advantage plan, then there isn't any charges other than once you hit that, then you don't pay anything in additional to that. Now, also in the Advantage side, the supplement, I'm sorry, there's no copays, so it's shared expense. There's no deductibles, but there is out-of-pocket, and that's what I was talking about. The prescription drug plan is usually integrated with the Advantage side. The only exception to that is if you are a veteran and you decide you want to enroll into an Advantage plan. There is Advantage plans out there that does not have drug coverage because you have that drug coverage through the VA. So the prescription drug is included with the Advantage plan, but you still have the copays just like you would have on a standalone drug plan. So that's the reason why a lot of people are looking at the Advantage plans. Now keep in mind, if you're used to a supplement and you decide to go into that Advantage plan, anytime during that first year that you go into that Advantage plan and you're not happy with it, I can move you back to the supplement that you left to go into the Advantage side. So one time in a lifetime, you get into an Advantage plan and you're not happy with it, I can move you back to your supplement. No help, no loss of coverage, no options. You would just go back to the supplement plan that you had before. So it's kind of a way that you can get that trial if you decide that you want to take a look at that Advantage plan. Again, people that are used to supplements, it's a different world because in the Medicare, it's medically necessary, and Medicare is pretty lenient on the coverages that you get. Sometimes on the Advantage side, you have to have everything pre-approved from the Advantage company. So, people, once you get used to that, they understand it, and if there's going to be a surgery, then they have to have that pre-approved. I know that I've said to some of my clients that have the Advantage side, I said, what you need to do is find out all those copays before you have that done, so you have a good idea of what's going to be a cost for you when you get that first coverage. Because some of the coverages, I'll give you an example on the, if you go into a specialist, there's a copay that has to be paid when you see the doctor. So there's a lot of different ways that the Advantage plan works totally different than the supplement. And I have clients that go, well, which is better? And I'm going, really, it depends on you. It depends on, there's a few more hoops that you have to jump through on the Advantage side that you don't have to do with the supplement side, because your Medicare supplement is tied into your Medicare card. So when you go to the hospital or the doctor, you show them your Medicare card and your supplement card. And then they basically know by looking at what plan you have what the cost would be. And you know that besides your monthly premium and that $283 deductible, that's all that you're going to have out of your pocket. So in the Advantage plan, because it's pay-as-you-go and it's out of your pocket on all the services, it makes it a little more difficult for some of the patients, especially if they were used to the supplement. Now, again, I have some clients that have a Medicare Advantage plans, and they've been on that since they've been on Medicare, and they don't have any problem with it. They enjoy their Advantage plan. And in most cases, when we have people moving from the supplement to the Advantage plan, that's why I tell them that they have the first year. During that year, and they decide they want to go back to that Medicare supplement, I can get them back into the plan that they had. No questions. You don't have to answer any health questions or anything. It's a guarantee to move you back. And so it's a good chance to try it to see if that's what you like, and knowing that you're not stuck if you find out that you don't like that Advantage side. So with that, we've gone through the differences between the Advantage side and the supplement side, and the Medicare Advantage election period. So I'm going to touch on this just for a few minutes because we have about 5 minutes left. The enrollment into an MA or prescription drug plan is during the election periods only. And what this means is, we talked about the initial enrollment into Medicare, the 3 months prior, the month of, and 3 months after. Well, then you have the annual election period. That's open enrollment. And this really only applies to prescription drug plans and the MAPDs, or the Medicare Advantage plans. October 15th through December 7th with an effective date of January 1. And then they have another window, Medicare Advantage open plans, open enrollment period, was January 1st through March 31st. So, and basically, this being March, I can move you over sometime in March with effective date in January. If you find out that you're on an Advantage plan, you're not happy with the one that you're on. So that's basically a small part of what we cover in our seminars. Of course, we get into a little bit more in depth, and we will start our seminars next month. And with that, I will be seeing you on the first Tuesday, in April. So first Tuesday in April, here on WRMN Radio at 9 o'clock. And of course, if you have any questions, feel free to contact me at 630-320-6906. And with that, I appreciate you listening, and I'll see you next month.
Here's the best part. Right